Well, hello, I'm Simon Crewman. I'm the Professor of Supply Chain Management here at the University of San Diego. And I just wanted to spend a few minutes talking about specifically procurement strategy under the current coronavirus epidemic and potential pandemic. And there are three key mitigation strategies that I want to address. Firstly, identification of critical resources. Secondly, the issue of price and supplier relationships. And thirdly, critical action plans. Why do we care? Well, at the moment, we're really seeing how much supply chains run the world, the extent to which we're so dependent on the movement of goods around the globe. And here's just an indication of some of those products. Quite a busy graph, but the whole point of this is to identify that a whole variety of products, including Apple's iPhones, laptop computers, Levi's jeans, pharmaceuticals, and Toyota automobiles, really move around the globe, not just in distribution, but in the supply side, in the manufacture of components, the processing of materials, the assembly of vehicles, and so forth. And therefore, when I say that supply chains run the world, they really do have a massive impact on every organization. So I wanted to really think about the identification of critical resources. This has to be the first step in any procurement risk mitigation, and that's to identify who on our supply side, upstream towards our sources of supply, who on our supply side is located in areas currently affected, whether it's in China, whether it's in Southeast Asia, whether it's in Europe, whether it's in the United States, wherever. Where is your exposure in your supply chains? Which products are more likely to be affected by global factors, global pandemics? Which supply side items are more local? For example, we're seeing that pharmaceuticals are a global product. We're seeing that many IT products are global products, yet materials such as indirect materials in particular, such as toilet paper and some cleaning products, are very much local supply chain. But do we know? Do we as an organization know where our suppliers are? Do we have contingency plans? Do we have a second source of supply or alternative sources of supply? Do we have any strategic inventories? And I'll talk a little bit more about that. But we also in procurement have to think about the demand side. What's happening in terms of our employees who work in our operations, work in our facilities, work in administration? And what about our customers or our users? Whether they're retail customers, whether in my case they're students at a university, whether they're hospital patients, whether they're clients of a bank, where are they and where are they at risk? If a massive part of your service or your operation involves co-location of customers on facilities, hospitals, universities, then we have to think long and hard about our facility strategy. Firstly, how do we manage a deep clean process? Do we have the resources for that deep clean process? And what about isolating certain facilities? If we find, for example, that there is a higher incidence of exposure in one building compared to another, what contingencies do we have to even be able to lock down that facility? And what are your alternative fulfillment strategies? How else can you deliver your services? I'll give two examples. One example is that I've noticed that my healthcare provider has already responded to the coronavirus concerns by offering telephone consultations, and that involves two extra stages in the process. You can contact your healthcare provider through normal means, through their app, through phone lines, through email messaging. You will get a response from a first responder. By that I mean a nurse or a nurse assistant, a physician's assistant. Then a follow-up phone call with your primary care provider, your doctor, before assessing whether you need to physically attend the facilities. Second example, obviously what I'm doing here as a university academic is producing, in essence, a lecture, a virtual lecture. So recording course materials using Zoom or GroupMe or Skype or FaceTime as a means of interacting with students. To what extent have we actually embedded that in our facilities, in our fulfillment strategies? Do we actually have employees who are trained? Do we have enough capacity in those resources? Pretty critical questions which we're going to see tested in the coming weeks. Second issue is that of price and supply relationships. Firstly, do we routinely conduct purchase price analysis? Do we know the right price for our goods and services? Are our contracts fixed prices? Are suppliers able to activate escalation clauses? Really, we should be able to identify these very, very quickly from our contract database, but that's making the big assumption that we have that sort of operation in place. Secondly, are suppliers price gouging? We've certainly seen lots of examples of price gouging in the past with the Icelandic volcano, with the tsunami, with a number of natural disasters, and the coronavirus scare is no different. We're seeing price gouging already. But this is compounded in organizations by the fact that the central procurement function may well have strategies in place to deal with potential stress on supply. But what about procurement card holders? What about those people who have responsibility for ordering or purchasing indirect supplies? Many organizations, the majority of employees, have some discretion on being able to purchase goods and services. To what extent have we clamped down on P-card purchases, for example? And thirdly, critical action plans. What form of risk assessment do we have in place? Does your risk assessment map the supply chain? Can you identify all of your inputs? Do you know who your strategic suppliers are? And what is your inventory plan? Have you adopted VMI, vendor managed inventory? Do you classify inventory by risk factor? Containment strategies, critical assessment processes, risk analysis, kind of increasingly routine in organizations, but I would argue many of them overlook procurement. Are you lean? Do you operate lean supply across your direct and indirect supplies? And what is your contingency plan for lean supplies? There's a lot of benefit with lean, but when you're faced with unusual events such as the coronavirus, which disrupts your supply line, then you become anorexic, you become devoid of resources. How do you classify your critical resources in the event of different types of risk? A critical resource during a pandemic is very different from a critical resource during a financial crisis or a natural disaster or terrorism stroke active shooter. Those events have very different implications. So do we rehearse a range of different risks, external disruptions? And I want to kind of emphasize what I think are two distinct groups of risk. We have those that are finite and those that are infinite. Finite risks are usually those that are time limited. In other words, the impact is limited to a feasible, estimable time horizon. Infinite risks are continuing crises. In other words, we cannot realistically estimate the end point. Give some examples of how we would even consider that, thinking about our risk assessment for a whole range of supply issues. Here we have the situation of, I think, a classic risk assessment. We map the likelihood of an event against the consequence of that event. And what I would undoubtedly do here is not only discuss the likelihood, I would add in additional rows for different times of finite and infinite crises so that we understand what the implications are. But as you can see, when we have extreme impact and moderate likelihood, it's still a very high consequence in disrupting our supply chain. So infinite risks include things like pandemics, nuclear disaster, war, major infrastructure destruction, major natural destruction such as wildfires and intense drought that really have an impact for several years, if not longer. With the pandemic, at the moment, the best estimate is that it's going to have an impact for at least 12 months, at least until spring 2021, but it may pervade even longer. Nuclear disasters like Chernobyl, we've seen 20 plus years of disruption. War can be ongoing, depends where the war is and how it affects you, your organization, your supply lines. Major infrastructure destruction, an earthquake in California can basically destroy most of the transport infrastructure, and that can take quite some time to rebuild. And as I say, wildfires and intense drought can have a long-lasting impact on natural resources, habitation for your employees, supplier facilities and your facilities. The problem is that most organizations are not prepared. And in terms of infinite crises, we tend to rely on local authorities, central government, voluntary organizations, the military. And there's this a preparedness gap that for the infinite high impact events, many organizations defer to central government, regional government, NGO preparedness. And that's just not sufficient. We're seeing with the coronavirus that really central government can do very little in terms of helping to mitigate supply chain and operational disturbances. What it can do is address the critical public health issues, but not your organizational and operational preparedness. So in conclusion, I think there are 4 key headlines to take away. 1, know your supply chain. Know where your suppliers are, which of those supply lines are critical to your operation, and maintain that visibility of your supply and your demand side. Enact mitigation strategies to try and constrain rogue and maverick operators. That includes suppliers who are trying to price gouge, your own employees who are undertaking rogue or maverick purchases that are off contract. And finally, we clearly need significant and deep training in preparedness and operational backup for our organizations. I hope this at least helps us to think more clearly about how we can at least mitigate the risks that are going to arise increasingly from the coronavirus, and make sure that every organization at least takes steps to minimize the operational and financial impact of the crisis. Thank you for watching and listening, and if you'd like to learn more or want to get in touch with your thoughts, here's my email address. I look forward to hearing from you.